Good afternoon, everyone, and thank you for joining us this afternoon for our Autism Awareness Program. This is Dr. Katherine Bellone Mount, or Bellone Mount. She'll be doing our program for us today, and I'm going to pass it over. Thank you.
Thank you so much, and thank you for the chance to talk with everyone about autism. It's something that I'm incredibly passionate about and have kind of dedicated my career to. So I'm hoping that everyone who has joined will send in questions and comments so I can make sure to address the things that you're wanting to know about autism. So I figured I'd start with trying to learn a little bit about what brought everyone here today. We'll cover kind of what autism is, what we know about what causes autism, and then we'll go over discussions of some of the symptoms and treatments, as well as how to support people who are on the autism spectrum. So I work at the Center for Autism and Developmental Disabilities, which is kind of a joint clinic that's sponsored by UT Southwestern Medical Center and Children's Health of Dallas. So we serve children and adolescents who either are suspected of having autism or have a confirmed diagnosis of autism spectrum disorder from 0 to 19. This says 18, but we're able to serve families through the child's 19th birthday. And really that can look all different kinds of ways. We do have a sort of certified program that is specialized in doing first-time diagnoses for young children on the suspected of being on the spectrum, as well as provide services such as therapy and family therapy to work on some of the things that might make it difficult for families of someone on the spectrum to feel successful or to feel like they're supporting their child well. So my role there is that I am as a therapist. So I work with families they might have a child who has major meltdowns or major anxiety, and I work with them to figure out strategies to kind of make life at home better and to work with that child to make sure that they're feeling supported and understood to kind of have their best life. So it's kind of about me. So I have been doing this type of work for 14 years, and I still learn something new every day, mostly from my patients, of teaching me a different way to think about what it's like to be on the autism spectrum, or teaching me a different way to conceptualize what it's like to have autism. So I still love my job for many, many reasons, that being one of the main ones. I'm not sure if I can send a poll, but maybe if anyone's listening who wants to tell me kind of what brought you here today, whether that is that you know someone with autism, you might have a child with autism, you might just be curious about the topic, because certainly I know that it's something that's covered pretty widely in media now, or you yourself might be on the spectrum. So I would love to hear kind of if anyone wants to share what brought them here to the topic, so I can make sure to talk about something that might be interesting to you. To start, I'm just going to go over what are autism spectrum disorders. So as you might know, in the past, these were things that were labeled with separate diagnoses like autistic or Asperger's. And so about a decade ago, the big diagnostic manual that psychologists and other healthcare providers use decided that we should just have one spectrum. So changed it from those different diagnoses to just saying the autism spectrum. And so now that one label is used to describe all different kinds of individuals, but the kind of core things that make someone sort of meet criteria for having an autism spectrum disorder is that they have difficulty with their social interactions. They have a hard time communicating verbally or using nonverbal communication, such as eye contact and gestures and facial expressions. And then the other piece to it is sort of, so there's social and communication challenges. And then there's this other piece of what we call restricted or repetitive behaviors, which are things that the child or adolescent or adult might do that most other people wouldn't do. So things like hand flapping or body rocking or lining up toys on all in a row rather than playing with them. Like you can see in this bottom picture on the right, the little guy there is lining up the cars in a row and then kind of looking at them rather than driving with them or having a race. So kind of a restricted way of playing with them. And then the kid on the left, we see kind of covering his ear. So, you know, lots of people with autism spectrum disorders might have sensory sensitivity, such as having a hard time dealing with loud sounds. And so this is a pretty common thing that we might see. And so the other big area in terms of behaviors is that many people with autism have a difficult time when things change unexpectedly, especially. So change is difficult for most of us in general, but for people with autism, it is actually incredibly difficult even to tolerate a very small change in routine. So for example, a lot of the parents I see in therapy will tell me things like, well, my child likes to take a certain route to school. And if something is wrong with that route one day, such as traffic is backed up or there's an accident or they're doing work on the road, the child will have a meltdown in the car because the parent tried to change the route to school. So that's an example of a change in routine that the parent couldn't avoid, but that causes a major challenge for their child. So as I mentioned, this is kind of in a different form, talking about the same thing. So communication challenges, social difficulties, and then restricted or repetitive behaviors. And I gave some examples on the left. I've said a lot of these verbally, but just to kind of give another list for people to see. So repetitive movements, social challenges, difficulty understanding and responding to questions. So it's pretty common that if I'm working with, let's say, an adolescent who is able to communicate with me verbally, it's pretty common that after I ask something, there's going to be a pretty significant delay before they're able to respond. And that's really hard for lots of adults to wait in silence after a question. They sort of start to think, did they not hear me? Should I repeat it? Do I need to be louder? Are they ignoring me? And so kind of with some of the processing challenges that come along with autism, it's not that you're being ignored. It's not that the person's trying to be rude, but they're just processing the information and preparing an answer because it's a little bit more difficult for them. And so usually if we just give a pause, they're then able to respond in a comfortable way. The other thing too that we see is, let's say that you could imagine this in a preschool child with play, but also in a school-age child or teenager with school. So if they're doing one activity and they are working hard to focus on that activity and someone abruptly says, okay, it's time to move on to this, that can be really, really hard for someone with autism because they've sort of put all of that effort into doing the one activity and it's harder for their brain to adjust to a change or a transition. There are some examples. As always, I think it's important to remember that every single person is unique, just as all of us as humans are unique, everyone with autism is unique. And so these are kind of the general categories of behavior, but certainly every single person is different in the way that this feels and presents for them. So in general, when we think about sort of facts about autism, we know that autism occurs in all geographic, ethnic, racial, and socioeconomic groups. So it's not something that is only in America. It's not something that only happens in certain racial or ethnic communities. Unfortunately, though, what we do know is that there are biases in how families are able to access care for autism and diagnoses for autism. So we know that white children with autism are able to be diagnosed years earlier than a lot of children of color. So either Black or African American children or Hispanic children often are going to be later when they get diagnosed. And so I think it's important to know that it occurs in all people, but unfortunately, there are communities where there are barriers to care and barriers to getting the diagnosis that are being looked into and studied to understand how to make it more equal for everyone. The other thing that's really important to know about autism is that it's a lifelong disorder. So because it's a developmental disorder, it means that it starts kind of in the brain as a fetus, as the baby is developing, and then it continues to be part of that person's brain for the rest of their life. And so it's not something that children grow out of. It's not something that goes away, but it is something that can get a lot better. And it is something that looks different at different points in children's lives. And so this is one of the things that can be really hard for parents if let's say their 2-year-old gets diagnosed with autism. It's hard for them to imagine, this person is only 2 and you're telling me that they have something that they're going to have for the rest of their life. And so the way that we think about that is, yes, that's something that we're always going to be thinking about when we plan therapies and treatments and support ideas for this child. But that certainly, them being diagnosed at 2 doesn't mean that it's always going to be severe or it's always going to need support, but that child might just need support at different points in their life. And so it looks different for every family. So currently, the amount of children that get diagnosed with autism is around 1 in 54. So if you imagine the average classroom size is between 25 and 30, right? So if you imagine for every 2 classes in an elementary school, there's going to be at least 1 child with autism. And that is more than we used to see. And so I'm going to talk about that in a second. But currently, that's the estimate. And also what we know about it is that approximately 4 boys are diagnosed with autism for every 1 girl that is diagnosed with autism. So another way to say that is it's much more common for a boy to have autism than a girl to have autism. And there's different theories about why that might be, such as that there's things about the way that brains differ in the way that they develop prenatally between girls and boys that make boys more risky to develop autism, as well as theories about the fact that lots of girls and young women might learn strategies a little bit better to kind of mask their symptoms so that they might actually have autism, but it's not obvious because they learn social skills to sort of hide those things in public or with their families. And so that's kind of some of the ideas about why this might exist, but currently that's what we see. So this is kind of an important part to think about because we get so many questions every day at the clinic on what causes autism. And it's a complicated question. So there's kind of a complicated answer in that we don't exactly know. And the cause is different for different families. So what we do know is that it seems that the majority of cases of autism happen because of genetics. So the DNA that child has resulted in them having these symptoms. And for some families, that is that they inherited that from another family member, so that we do see that autism runs in families. But for other families, it's a completely random thing that happened when their baby was developing. And so the hardest answer for most families to accept is that it wasn't anything that anyone did. It wasn't anything that anyone could have controlled, but it was just a random thing that happened or something in their DNA that they couldn't have possibly known. And so that's a hard piece. The other thing that we think about is when a mother has maybe had like a really severe infection or experienced exposure to certain toxins, there seems to be some relationship between that and a child developing autism later. As well as we know there's certain things that might happen at birth, such as an emergency situation where the child goes without oxygen for a long time. And then we would know that that has impacted their brain. And for some of those children, when they grow a little bit, will start to show symptoms of autism. So those are some other things we see. The most important thing for me is that families know that there's absolutely no link between autism and vaccines. So the study that was done in the early 90s that seemed to say that that was true was actually found to be false. The person who made the study had lied about the data and caused this huge problem because then families were not seeking vaccines for things that were actually preventable. And so as a result, lots of children developed conditions that could have been avoided through the use of vaccines. And so it's really important to me to help families get educated on this topic because we want their kids to be as protected and safe as possible. And there are, of course, unique situations where someone might have a specific allergy or a specific sort of risk factor with vaccines that are unique to them. And of course, that should be discussed with their doctor. But in general, when we look at studies of thousands and thousands and thousands of cases, there's not any link between vaccines and autism. And the other important thing is that in the past, there were people that believed that mothers who were not emotionally connected with their child enough could possibly cause their child to develop autism. And we know that that is also completely false, and that it has nothing to do with the parent-child relationship that someone might develop autism. That's another really important piece to educate others about, because in my experience, mothers of children on the spectrum are already carrying around so much guilt because their child does have something that is impacting their life. And so it's really important that we help support moms in general, but especially moms of children on the spectrum, to know that it's not their fault and that there's nothing that they did that caused this to happen. And that it's not, that even though there are hard moments, it's not something to feel is it's not a terrible thing, that we can still find hope in the situation, of course. So some of the things that have been asked is, okay, so if it's not vaccines, then why are the rates getting so high? So in this graph, you can see that in the year 2000, only 1 in 150 kids were diagnosed with autism. And obviously now I just told you, so when this finished in 2010, it was 1 in 68. And now in 2021, it's 1 in 54. So the reason that we kind of think is going on is that we as a society and we as a field have gotten better at noticing it and diagnosing people appropriately. So historically, we know that lots of people who have autism were diagnosed with other psychiatric conditions. So if any of you have ever watched the movie Temple Grandin, that follows the life story of a really famous woman on the spectrum, I believe her parents were told when she was only 5 or 6 that she had schizophrenia. So a lot of people in decades ago, that was the only label that doctors knew to use. So they would label children with that, and because they didn't understand the autism spectrum. The other thing we think is that we've gotten better at noticing that people who have verbal skills and are cognitively doing well in school can still have autism. So we've gotten better at capturing those people who have more of like the Asperger's presentation of autism or version of autism, who previously may have just kind of not been diagnosed and just struggled socially or struggled to find a job and not been able to kind of meet their full potential. So that's kind of what most scientists and most providers in the field believe about this. And then too, you know, some people say, well, I just think everybody's being diagnosed with it these days and people are just using that label too much. It's not something I see personally. I think, you know, of all the kids I meet who have been diagnosed, it's appropriate in those cases. And I understand why it was made, even though I'm not the person diagnosing them. And so the importance there is that we make sure that they were diagnosed by someone who was appropriately trained, and that kind of related to that we're getting information to pediatricians, because this is something that the understanding of this has changed drastically in the last 10 years. And so we have a lot more information now that can be really helpful. One of the places I see this the most is that we know that really a strong diagnosis can be made by the time a child is 2 years old. And so previously, that really wasn't the case. That previously we would think about 3 or 4 years old as an age of kind of when we could definitively diagnose someone with autism. And now with the tools that we've developed and the training that happens, we really can do that by 2. But unfortunately, a lot of pediatricians are still telling parents to wait before they seek testing. So kind of, we call it like a wait and see model. So they say, hey, yeah, we're seeing some red flags, but let's just wait and see if they grow out of it. And then unfortunately, by the time maybe a child turns 3 or 4, if they're still exhibiting those symptoms, then it's even harder for the family to get into an appointment and might delay that child getting a first-time diagnosis to start care. Versus if they're 2 and they start seeing red flags and get them referred, we can get them diagnosed earlier and start getting them the treatments they need to help them in the long run. So that's one of the biggest things that we try to talk with families about and do outreach in the community about, that if a parent or a pediatrician are seeing red flags for autism, and I'll talk about what those are in a minute, that they go ahead and refer them for an evaluation so that we can just take a look. And going through that doesn't mean that their child is going to come out with an autism diagnosis unless it's really the most appropriate diagnosis. So a lot of families start with something like going to early childhood intervention or ECI in their community, and seeing what the ECI specialist thinks. Also talking to their pediatrician about what they're seeing at home to see if it might be important to get an evaluation. So we really try to encourage people not to wait and see, but instead to just start the process of getting a diagnosis if it's something on their mind. And the reason for that is that we know that the earlier we're able to diagnose a child, the earlier we're able to get them into services. And there's a lot, decades of pretty compelling research that shows that when we're able to get children into earlier therapy services, they have better outcomes as they age. And so just in terms of behavioral functioning and social functioning and communication. And so we really try to put an emphasis on getting kids evaluated and diagnosed, if appropriate, as early as possible. So in terms of red flags, what do we look for? So one of the ways you can think about this, and I heard someone say this a few years ago, and I've used it since then because it was really helpful, is we think about that this particular child is doing things that other children typically don't do, and they're not able to do the things that other children typically can do. And as for examples of that, doing things that children don't typically do would be things like unexpected finger or hand movements. So an example of what that looks like is like children who might flick their fingers in front of their eyes, or hold their hands out in a way and kind of look at them in a way that's sort of unexpected or abnormal. Lining up toys, as you can see in this picture above, this little guy, even though he only looks to be maybe 2 or 3, has lined up all the cars and sorted them by color, right? So yes, it could just be the way he likes to play, but we should take a look and see if there's any of the other red flags going on too. And so with that being said, we don't ever make a diagnosis just because a child shows one symptom. We are going to look for this whole group of symptoms across multiple situations to make sure that we're really making an appropriate diagnosis. The other thing that I mentioned at the start was things like insisting that we follow the same routine every single day. So things like eating off the same plate, drinking out of the same cup, eating the same foods, wearing the same clothes, like an extreme degree of sameness. Another thing that children typically don't do that children who might be at risk for autism do is what we call echolalia, meaning that they repeat back the same phrase that someone has just used in the exact same way. So as an example of this, if I say, "How are you?" their response is, "How are you?" So instead of answering, they just echo back the thing that I've just said to them. And then not doing things that other children typically can do. So doing things like eye contact with other people, sharing enjoyment with other people. So that means that if they're excited, they smile, and they not only smile to themselves, but they connect with the adult around them through things like eye contact or looking towards that person to show them like, I really am having fun, or I really like this. Responding to other people's social gestures. So if somebody waves to them, they wave back. Having a back and forth conversation instead of just talking about what they like to talk about. And then being able to use facial expressions. So for some children at risk for autism, their face tends to look kind of blank or flat a lot of the time. So you're not seeing big smiles for excitement. You're not seeing frowns when they're sad or angry. And so just kind of looking sort of flat all the time would be another thing we would look for. So once we diagnose a young child or adolescent or adult with autism, we're going to make recommendations for what type of treatment might be helpful. And so one of the things that is important that we help parents understand is there's not a cure for autism. So there's not a medication or treatment that can happen that's going to get rid of the person's autism. And in some cases, I think it's important that we not even think about that because, you know, the way I explain it to my patients, autism is just another way of being. And so certainly we don't ever want it to feel like we're saying that we should get rid of someone's autism because it's what makes them unique. But we can do things for those symptoms that are causing them significant problems in their life. So the things that I often am treating are things like really severe meltdowns that they might have at home, in public, at school, when one of these events occurs, like a change. So I know that when they're doing that, not only do they feel miserable, but it causes a really significant challenge in them doing what they need to do on a day-to-day basis. So I'm going to treat that part of their autism symptoms without trying to take away or change anything about them. And so the majority of interventions that we know are effective are behaviorally based interventions. So people might have heard of applied behavior analysis. And that's one of the most evidence-based treatments for autism. You might have seen autism ABA clinics popping up around town, around your neighborhoods. And it's because it's a treatment that has decades of research behind it in terms of being very effective. For medication approaches, there are not any medications that treat the core symptoms of autism, but there are certainly medications that help manage, again, the symptoms that are getting in the way. So things like children who are severely aggressive or who hurt themselves, like through banging their head or biting themselves, those are things that obviously we're not going to ignore. And so sometimes we use medications to help manage those really severe concerns. And then what we know is that for most children and adolescents and adults, it's really going to be about combining treatment. So maybe doing therapy, getting them speech services, occupational therapy, sometimes physical therapy if they're having trouble with things like balance, and then combining that if necessary with medication as well. The other part that I really like to talk about when it comes to treatment is just being very careful and wary of anything that promises to be a miracle cure. unfortunately, in my experience, parents and families of children on the spectrum are one of the most vulnerable groups to these people who promise cures. And so they will invest many, many dollars into trying to do these miracle cures that ultimately are not helpful or effective and can actually be dangerous. So the FDA has actually put out warnings about several of the things that are marketed because in fact they can cause harm to a child. And so I'm happy to answer questions if anyone wants to know more about that, but just a warning there that there are no miracle cures, and that looking into those can sometimes do damage to kids and to families. I saw a question come in on the chat that was asking, can autism be misdiagnosed as ADHD? So certainly, I have seen that happen in school-age kids who were very, very bright and who were doing well academically, but maybe had more of the social and behavioral challenges. And so I think that's a place that's really important. So I've seen it in both directions. I've seen kids suspected of autism who we evaluate and end up diagnosing ADHD instead. And then I've seen kids come into clinic who had been diagnosed with ADHD and who actually also had autism. And so it's usually not an either or. So for many children, they might have ADHD and autism. And for some, it's just one, but those are things that can be diagnosed at the same time because a lot of children with autism also have challenges with attention and hyperactivity. So I hope that answers your question. It's just a good place to get in with a child psychologist or diagnostician in the school who can do the assessment needed to kind of tease those things apart. Okay. So in terms of, let me see, there we go. The other piece that guess I skipped a bunch somehow. Oh no, it went, I went to the last one instead of going to the current one. Let me get back to this. Okay, so in terms of treatment and transition, the other thing that we have been putting a lot of effort into in our clinic in the last few years is realizing that the kids that we're serving now are very rapidly becoming adults. And the state of adult services for people with disabilities in general is really not great, but especially for autism. And so it's an area of huge need. And in fact, individuals on the autism spectrum are one of the most underemployed and undereducated groups of individuals because they have such a difficult time accessing support services. So unfortunately, many adults, young adults on the spectrum don't end up going into full-time employment, so are either unemployed or underemployed and have difficulty going into like a community college or college setting without support. And so it's a really vulnerable age and a really vulnerable population that we try to help support. The other thing that comes up a lot is helping them navigate relationships, helping them navigate social relationships at this age, romantic relationships at this age, understanding kind of the legal part of turning 18. So making sure that they're protected in terms of not being taken advantage of or not falling victim to kind of mistreatment by anyone. And so for some individuals on the autism spectrum, they are going to become their own guardians at age 18. And for others, their family is going to go through a process of obtaining guardianship if they're not able to make safe decisions on their own. That's a very long-term process, a very difficult process, and a very expensive process. So we also try to educate families about other options if guardianship is not in their plans or in their possibilities for now, that there's something in Texas called a supported decision-making agreement that can be a really nice compromise that legally acknowledges that this person is their own guardian, that they're an adult, but they need help making really important decisions like medical decisions. And so this is a form we use in our clinic when someone turns 18 that allows their parents to still be part of their care. And so it's a really nice compromise for some families who aren't sure they want to fully become their child's guardian, but who know their child might need a little extra help. And so what we try to help families do around this age is find something that their child is passionate about, that they're skilled at, and that we can support them in finding employment or education around in the future. I just actually got an email this morning from someone I hadn't seen in a few years because he had aged out of my care. And his mom was letting me know that he has been working at Lowe's for the last 6 months and really loving it and making friends with his coworkers. And so he is someone who had a harder time with social interaction. So he got pretty overwhelmed when people asked him questions. So the nice compromise there is he's working in the warehouse section of the store. So he unpacks boxes and he organizes things, which plays beautifully to his skill set. And then he can kind of help with customer services sometimes, but not every day, which was ideal for him. So those were conversations we were having in therapy of figuring out what was his comfort zone and then brainstorming maybe some places or some options that were good to consider. So it just made my day to get that update this morning. The other thing that I try to think about whenever I'm talking to kind of groups in the community is just that it's really important that we have a broad understanding of what it's like for someone on the autism spectrum. So there's been this big movement, I would say, in the last 5 to 10 years of encouraging self-advocacy for individuals on the spectrum. And for some of those people, they've actually started wanting to use the word autistic again. So I usually try to let my patients tell me what they like me to use, whether they want me to use the word autistic or whether they want me to use the word person with autism. And so in this graphic, it was made by someone who is on the autism spectrum. And I thought it would be helpful for us to look at it today. So it says something on the left, which is what people think the autism spectrum looks like. And it says less autistic on the left, more autistic on the right. And then what it can actually look like. And it shows all the complexities of what people on the spectrum would actually go through. So things like depression, getting fixated on something, having abnormal or flat speech, being sensitive to sounds, having social challenges, anxiety, poor eye contact, tics or body movements, and then aggression. And so then the author followed it up by putting this, and I call it neurodiversity. But the comment that was made was, no two autistic people are exactly alike, but we shouldn't be reduced to high functioning and low functioning either. And then in this person's case, they say, my autism looks like this, and it's kind of the drawing on the left. My brother's probably looks like this. So sharing that this person and their brother both have autism or both are autistic, but have different versions of that depending on their own unique experiences. And so then the conclusion is we have the same amount of autism, but just different symptoms. And I think that's a really nice perspective for us to think about, because you'll often hear people say things like, oh, well, that person is lower functioning, or that person is nonverbal, and that person is high functioning. They have Asperger's. And I think for many people on the spectrum, it can feel really offensive to be kind of categorized in that way. So just kind of being aware of the beauty and neurodiversity, that we all have our own unique sets of challenges and strengths, and that we can all continue to grow and develop as we age. So with that in mind, as I mentioned, I try to allow self-identification for labels. There's been this kind of controversy about Autism Speaks. If you're not familiar with it, Autism Speaks is a huge American and international organization that's by design supposed to be an organization that brings awareness and support to the autism spectrum. But for some people with autism or autistic people, they don't like that the big logo for Autism Speaks is a puzzle piece, because they say it makes them feel like they're missing something or that they're not complete. And so there's these protests that happen, as you can see in this picture, people, not puzzles. And so I really encourage my patients to become self-advocates, to describe how their reality is and how their experiences are, so that I can learn about it, but then that they can help educate others who maybe aren't understanding them or aren't supporting them. And then the other part that I always emphasize is that every person with autism is unique, as I said. And so there's this saying in the field of working with people with autism of, if you've met one person with autism, you've met one person with autism. And so not trying to overgeneralize, even though obviously we have to talk about things like what are the symptoms, what are the causes, but just that I can tell you as someone that by this point in my job have met hundreds and hundreds of kids on the spectrum and adolescents on the spectrum, that this really is true, that every single one of my patients is incredibly unique. And it's just a true joy to get to learn about them and for them to teach themselves about me or me to them. And so it's been just a really incredible thing to be able to dedicate my career to this. So one of the things that I like to do is to help sort of get rid of myths about the autism spectrum. So this book that you see on the right is written by someone named Zsoja Zaks, who I had the privilege of going to a workshop that they offered. And so this is all from this person's perspective, but basically they said having social challenges does not mean no socializing, no interest in others, no sex drive, no longing for love, no interest in being part of a family, or not wanting to be touched. And I think that I've actually heard professionals in the field who had some of these myths of, I mean, I've heard them say things like, oh, well, you know, kids with autism don't like to be touched, so you shouldn't touch them. And I always respond to that as saying, well, I don't like to be touched unexpectedly, but that doesn't mean I don't ever want to be touched, right? So I think really important for us to get rid of this idea of autism means this one thing, and instead to kind of let each person with autism teach us about what it means for them. The other piece that this always comes up when I'm supporting parents and kids is, you know, as they're going through puberty, their parents might have a sense of, oh, well, I know developmentally they're much younger than their age, so I'm not really worried about teaching them about sex or teaching them about relationships. And unfortunately, I always have to tell them, so even if their mind is not the age of their body is their age. And so they're going to go through all of the hormonal changes of anyone else their age and are going to have feelings of wanting romantic relationships, feelings of sexual desire, all of that stuff that are really important for us to kind of sit back and acknowledge the whole person that's in front of us, and what they might be interested in, what they might want to do, and how to keep them educated and support them in being safe as they explore those things. Another myth that I hear talked about and that I, again, have heard professionals say in talks that I've done or ask me questions about in talks is, oh, so, you know, I've seen the movie Rain Man. So does every kid with autism have a special gift, or is every kid a savant? So if you haven't seen that movie, Dustin Hoffman portrays somebody with autism and is able to do mathematical equations in his head very quickly and count very quickly. And so he's sort of gifted in that way. And so there's this myth that everybody on the autism spectrum has a similar giftedness. And I think it's a myth that can be really hurtful to people on the autism spectrum as well as families of people on the autism spectrum, because that's not true. I mean, not everyone has that, certainly. And so if there's then this expectation of, well, everyone must have some special gift locked inside, for a family who's not seeing that, it can be really hurtful to them. That's the belief of like, well, then something's extra wrong with my child, right? And so certainly not the case. I mean, we do see that sometimes, and it's incredible to see, but it's not something that happens for all families or all children. And so the other thing, and kind of as we're wrapping up, I'm going to talk about the human spectrum. So that many of these situations really are a difference in perspective. And so I'm going to share with you this table that was made again by Zsoja Zaks, who's an adult with autism. And so the thing here is that if we think about challenging what anyone without autism might think, so the neurotypical perspective, we can think about what that is like versus the neurodiverse or autism perspective, right? And so as an example, the neurotypical perspective is, well, the person with autism misses my jokes, they don't understand my sarcasm, and they don't understand body language. And he says, or they say the autism perspective is, the neurotypical person makes jokes that aren't funny, doesn't say what they mean, and blame me when I misunderstand. Another example, person with autism needs rules for everything, even feelings. Autistic perspective, the neurotypical person does not follow the rules. Person with autism can't come with me to family events, outings, and trips. Neurotypical person doesn't understand why I need time alone. So I think, a really nice way to kind of take a step back is, whenever I'm working with families, thinking about what is this person on the spectrum communicating to me about what they need, and how do I help their family understand that need in a way that works for everyone else and honors the person on the spectrum. And I think this is a nice way for us to start thinking about that being able to interpret jokes doesn't have to be part of life, right? There's not a good, bad judgment about whether someone enjoys jokes or not, but it could be something that we help educate the person of, that seems to be a little bit harder for you. These are ways you can respond if someone misinterprets that. And so just kind of taking the value judgment out of those situations and instead looking at it as, what is this person telling us? What do they need? And how do we kind of meet in the middle somewhere? So I intentionally wanted to leave at least 10 minutes for questions, and I see that I'm doing well on that time frame, but I wanted to kind of have anyone share what were some of your own ideas about autism that you came into the talk today with, or what's something you've learned about autism and will take with you after the talk.